Hello everyone, my name is Dr. Manish Yadav. I am here to talk about something very important. I am here to talk about two gems in homeopathy. Not gems, I think you heard correctly. They are James, but actually they are gems in homeopathy. The two James, James Tyler Kent and James Crompton Burnett. We have been learning about Kent since our college time. And I have realized, as other homeopaths, that the contribution of James Tyler Kent is par excellence in homeopathy, and it has helped many homeopaths to gain some great results, good results, and give relief to so many patients. But there is one James which has been already misunderstood. In fact, not misunderstood, it has never been understood. When I started my journey in homeopathy, and especially the zeal to treat difficult and challenging pathological cases, I got acquainted with all the teachers and masters who are following James Tyler Kent's process. And of course, you are all aware of that James Tyler Kent, the analysis, the philosophy that he has given, it has helped a lot. What does he talk about? He talks about, when you read his lesser writing, how to deal with pathological cases, he says that you have to focus only on the general symptoms. Pathology is actually not important. And that is what people look for. We take constitutional cases, we look general symptoms, and I can give you my examples, in my cases, clinical examples, so many cases where general symptoms were taken and it has really helped patients. So I'm a great follower of James Tyler Kent, but there were many parts, many cases where the pathology is bad, where there are tumors, the philosophy does not hold. Also, an ardent student who will read lesser writings of Kent, especially the cases, you will understand that Kent was not that rigid about his philosophy as his students are. That is seen in his cases. The lesser writing, you can find multiple cases where he has drifted from his philosophy and used certain specific pathological organopathic kind of remedies. So that brings me to you towards James Crompton Burnett. Both the people, Crompton Burnett talks about pathology, organopathy, specific remedies, ladder of change of remedies, and there is one person, other side, who talks about totality, maybe constitutional drug, general symptoms more important. How do we collaborate both of them? Are both needed or only one is important and you should discard others? My experience has made me realize that understanding Kent and Burnett both on the same plane can help your practice grow to multifold. Where Kent's philosophy gets stuck, Crompton philosophy comes. Where Crompton gets stuck, Kent comes. In fact, both are similar. But with Crompton philosophy, James Crompton Burnett philosophy, the only problem which I faced was whenever I connected with my teachers, my seniors, and always discussed them about the books. He has written multiple small books. So many philosophies there, so many cases are there. I was always disappointed. Why? All my seniors and teachers always said that we read Burnett but we understand nothing. He's a specific doctor. He's an organopathic doctor. He just gives organopathic remedies. He gives multiple drugs. There is no science behind him. Yes, you are correct. Because when you read his books, actually you understand nothing. And that was my experience when I first started reading his books. But slowly and steadily, thanks to all my teachers and mentors who have taught me about pathological cases, how to deal with them. Now at this junction, I have got, I'll not say complete knowledge, but at least I have been able to understand a little bit about what Burnett was trying to say. And more deeper as I'm going in my cases and in my understanding, I'm realizing that Crompton Burnett, what he was speaking is what Hahnemann stopped at. What Hahnemann, at his last letters of Hahnemann by Rima Handley, the book you read, I always promote that book. Where Hahnemann stopped, actually, from there Burnett picked up. And Burnett also used Kent, and Kent also used Burnett in many of the cases. So it is all synchronized because homeopathy is individualization. So what are we going to talk about? I'm going to talk about Burnett and his philosophies, his cases, and trying to explain through my personal experience how we can use his knowledge in so many stuck cases and go ahead and help so many people. Thank you very much.